everyone, my name is Christine Mitalang and today I'm going to do a return demonstration and a proper way of drying our hands after a surgical scrub. Okay, so a while ago I've actually done doing a surgical scrub. Okay, things to remember after a surgical scrub, we have to make sure that we remain or we hold our hands always above our elbow. We always do it in an upright position. Okay, so now for the assessment, the first thing that we're gonna do, of course, is to make sure that our towel will not touch anything that is not sterile, any unsterile object, or any part of our body that is not sterile. Okay? And then, of course, the second thing we have to put in mind is that we always make sure that our hands and our elbows are always above our hands, and of course our arms are always above our elbow, and as much as possible we actually hold our arms away from our body. Okay, because again, we still consider our body as of right now or our gown as unsterile. Okay, so the nursing diagnosis for this procedure is risk for infection related to improper aseptic technique, and of course the outcome that we would like to see here is for the patient to remain free from infection after the surgery. Okay, now going to the intervention, the first thing we're going to do is to take the towel in the middle part, making sure, of course, that we do not contaminate um, the um, the gown, okay, under it. So we take it from the middle part, okay, all right. So you have it this way, and then we make sure that we bend our waist a little bit forward, okay, to help the towel not to touch our gown, okay, or our surgical gown. Now the next thing we're gonna do is, of course, to go ahead and dry our hands, okay, okay, from the hands going down to the middle part of our arm, making sure again that the towel will not touch our gown. And then after that, using our dry hands, we go ahead and of course take the other end of the towel, okay, the dry end of the towel, and then wipe the other part of our hand. So again, we do it from our hands, going down to our mid arm. Okay. Now, things to remember. Once we actually dry our hand, okay, we proceed to the mid arm. Make sure do not go back to the hands again. Okay. So we always do it from up to down, from hands to the mid arm. Okay. So after we've dried the second hand, we go ahead and fold the towel. Okay. So that we can go ahead and dry our elbow. Okay, so we go ahead and dry our elbow. Okay, now we also make sure that anything, okay, we also make sure that our arms are well covered. When transfer of towel has been done from hand to hand, we make sure that, or we do not allow our hand to touch anything that the elbow has touched. Okay, and then after that, we go ahead and of course disregard or discard our towel, okay, to the linen hamper. Okay, and then after that, for the evaluation, we just have to make sure that we observe our patient for any signs of localized infection 2 to 3 days post-operative. So that's it for drying our hands after a surgical scrub. Thank you, and I hope you learned something.